The strongest and the thickest cartilage of the larynx, which also forms the base of the larynx, is the cricoid cartilage, which is also unpaired cartilage and made up of hyaline cartilage. So cricoid is the thickest. It is having anterior narrow, vertically narrow part, and posteriorly broad and quadrilateral part. The anterior narrow part is known as the arch of cricoid, and posterior broad or quadrilateral part is known as the lamina of the cricoid cartilage. So when we see the lateral view, it looks like this. So this is the anterior arch, and this is the posterior lamina. The inferior part is horizontal. This is the inferior part, which is horizontal, and upper part is elliptical in shape. So cricoid cartilage is forming the base or foundation stone for the larynx. All other cartilage are above the cricoid. So this is thyroid cartilage, and cricoid is below the thyroid cartilage. So in this model, this is the cricoid cartilage. This is anterior narrow part, which measures 5 to 7 millimeter vertically. So this measurement is 5 to 7 millimeter, and this vertical measurement of the lamina, this measurement is 2 to 3 centimeter. So when the arch runs backwards, it broadens and form the almost quadrilateral lamina of the cricoid cartilage. The arch of the cricoid is having anterior surface, the posterior surface, upper border, and the lower border. The upper border slopes downwards and forwards. So it runs downwards and forwards. Upper border of the cricoid cartilage is having two lips, the outer lip and the inner lip. The outer lip of the cricoid cartilage is, this is the outer lip, this is the inner lip. The outer lip of upper border is giving origin to the lateral cricoarytenoides muscle. So it is giving origin to the lateral cricoarytenoides muscle. which runs backward, upwards and laterally, which runs backwards, upwards and laterally. Lateral cricoarytenoides. So this is the arytenoid cartilage. So lateral cricoarytenoides runs upwards, backwards and laterally to be inserted on the anterior part of the muscular process, the anterior part of muscular process of arytenoid cartilage. So this muscle is the lateral cricoarytenoides. The inner lip. This is the inner lip. Is giving attachment to the cricothyroid membrane. Thyroid cartilage is situated above and cricoid is below. Here it is forming the cricothyroid joint, and joint is moving like this. Movement of cricoid is more on cricothyroid joint and movement of thyroid is less or almost no movements of the thyroid cartilage. So closing or opening of a visor. So this part, this space is occupied by the cricothyroid membrane. The upper part of cricothyroid membrane, the upper part of cricothyroid membrane is known as cricovocal membrane and conus elasticus. So this part is occupied by cricothyroid membrane. The lateral cricoarytenoides and cricothyroid membrane, cricovocal membrane, all are running beneath the thyroid cartilage. So these all are under surface of the thyroid cartilage. So the upper part and anterior part is thickened and known as the conus elasticus. Conus elasticus. The part of cricothyroid membrane running from the conus elasticus up to the fibrous capsule of the cricoarytenoid joint is known as cricovocal membrane. So this part is known as the cricovocal membrane. Cricovocal. And uppermost thickened part of cricovocal membrane is known as vocal cords. Vocal cords is the primary site of voice production. So inner lip is giving attachment to the cricothyroid membrane and outer lip is providing attachment to the lateral cricoarytenoides muscle. The outer surface, this outer surface is giving attachment So this is the inner lip, this is outer lip. Inner lip is giving attachment to cricothyroid, cricovocal membrane, and outer lip is giving attachment to the lateral cricoarytenoidal muscle. Now this anterior surface is providing attachment to two muscles. This medial part is for the cricothyroid muscle, and this part, the lateral part, is giving attachment to thyropharyngeus, lower part of thyropharyngeus, that is cricopharyngeus. Cricopharyngeus is part of inferior constrictor muscle of the pharynx. So this is the inferior constrictor muscle. So this part of inferior constrictor is known as thyropharyngeus, and this part is known as cricopharyngeus. So lateral part is giving attachment to the cricopharyngeus, and this anterior part is giving attachment to the cricothyroid muscle. So cricothyroid is having two parts. Taking origin from here, this is the straight part and this is the oblique part. This is cricothyroid muscle. Cricothyroid. This part is the straight part. The straight part is known as pars recta, and this oblique part is known as pars obliqua. So pars recta. Recta is straight and oblique is pars obliqua. The posterior surface of the arch is covered by mucous membrane, and it is having the ciliated columnar epithelium, also known as respiratory epithelium. The posterior part is the lamina. This lamina is again having upper border, the lower border, the posterior surface and the anterior surface. The upper part of the lamina is having two shoulders, convex, oblique. The convex, oblique elevations, and the arytenoid cartilage, which is pyramidal in shape, is resting on these two shoulders. The arytenoid cartilage is paired cartilage and resting on these two elevations or articular facets to form the synovial cricoarytenoid joint. So here we can see the arytenoid cartilage is sitting on the lamina. The articular facets are convex, obliquely placed, and long axis is downward, laterally, downwards and laterally, obliquely running. So this is the direction of the long axis of the articular facet or articular shoulder for the arytenoid cartilage above the lamina of the cricoid cartilage. So when we draw a line on the long axis of these articular facets, these will intersect at 50 degree to each other, permitting the rotation at right angle to this axis, and some gliding movements also to increase or decrease the diameter of the rima glottidis. The space between two vocal cords is known as rima glottidis or simply the glottis. So adduction and abduction of the vocal folds by limited gliding movements and the rotation of the arytenoid cartilage above the cricoid cartilage. The posterior surface is having a median ridge. This is a median ridge. So when we draw the posterior lamina, these are two arytenoid cartilages. This is the median ridge, and on two sides of the ridge there are two depressions. These are two depressions. So this part is having attachment of the longitudinal muscles of the esophagus. The muscularis externa, so longitudinal muscles of esophagus. Is attached on uppermost part of this ridge. The two depressions on two sides of this median ridge giving attachment to the posterior cricoarytenoideus muscle, which is attached on the posterior part of the muscular process of the arytenoideus. So this muscle is the posterior cricoarytenoideus. The posterior cricoarytenoideus. The posterior cricoarytenoideus is having a lateral part and medial part. Medial part is almost horizontal while the lateral part is vertical. The fibers of the lateral part of posterior cricoarytenoideus are running vertically upwards while the medial fibers are running horizontally laterally. So fibers here are running upward and laterally, while the fibers of the anterior, that is the lateral cricoarytenoideus, are running backward, upwards and laterally to be inserted on the anterior part of the muscular process, while the posterior cricoarytenoideus is inserted on the posterior part of the muscular process of the arytenoid cartilage. The inferior border of the lamina is giving attachment to trachealis muscle, the muscle of the trachea, while the inferior part of the arch is giving attachment to cricotrachealis ligament, which connects the cricoid cartilage to the first ring of the trachea. On the lateral side, almost the site where the arch joins the lamina, the indissoluble depression or the facet. This facet is for the attachment of the inferior cornua of the thyroid cartilage. So thyroid cartilage is having superior cornua and the inferior cornua. This is the site of the attachment of the inferior cornua and forming the cricothyroid joint, the synovial joint, which permits the rotation of the cricoid and limited gliding movements, like the closing of the visor and opening of the visor. So cricoid cartilage is the complete signet ring, only laryngeal cartilage to do so. So we have seen the anatomy of the cricoid cartilage. Now after a short break we will talk about the arytenoid cartilage, which is little difficult and interesting also.